Yes, Wellness by Design. Dr. Connie Casebolt Carver is with us. Dr. Connie, welcome back. You've gotten to be a regular.
I know, right? I can't stay away.
We need your good advice. We're talking hormones.
That's right.
Kind of our standard favorite that we started with years ago.
And the reason for that is we're all going to lose them.
Oh,
so
goody.
it's sort of universal. So look what you have to look forward to.
Yay! But I would have thought, I'm looking at the first kind of topic, and it says how male hormones are complex. I would have thought that would have been reversed in females, right?
Okay, so I always tell people, we women are more complex.
Right.
But that doesn't mean men are necessarily simple. So again, the caveat is that
I'm glad you said we're not simple. She mean
I was referring to the hormones. So what that means is we're going to carefully check everybody. We do check a few more hormones in women, but the point is we all need enough hormones and they need to be balanced. So for example, with men do need testosterone and estrogen. So we check both on those. Women also need progesterone, so we're going to check all of those, and then just make sure they're replaced in a safe, effective manner.
Are you saying, do women need testosterone?
Yes, so that's the other caveat too. Just like men need some estrogen, women definitely need some testosterone.
Yeah.
Not nearly as much as men, maybe about 1/10, but we need testosterone for self-confidence, for energy, for that attraction to your partner, bone density, and also testosterone is anti-inflammatory. So we see testosterone replacement in women often helping with things like headaches, joint pain, muscle cramps, or restless leg syndrome, that sort of thing.
Because you think testosterone, you're like, oh, manly man, but no, but so are we losing it, or like it's just part of when you lose hormones?
It's sort of, okay, as we age, of course, everything's going to go down. Women, of course, go through menopause where we fall off a cliff, but just stress.
More things to look forward to.
Yeah, I know, right?
Yeah.
So stress plays a big role. Stress can impact testosterone levels, and we're all under tremendous amounts of stress just living in 2019.
I mean, look who she works with. I mean,
that's the most stressful person. Yes, exactly.
So, so one thing that sets us apart is we carefully test. Not all offices actually test the levels, and we're also going to replace hormones safely. We don't use synthetics. Synthetics can have side effects. We also use the correct method, so we don't have people swallowing, for example, estrogen or testosterone, because that's harmful to the liver. So we're doing everything correct, and that's how we're getting the results that
And it's like a little pellet. You're making your, I mean, it's, I have friends that have been going to you, and they're like, oh, I got to go in tomorrow to get my pellets. I mean, it's
like a grain of salt.
Yeah,
grain
so pellets,
of rice, really.
Grain of rice, they're tiny, they're sterile, so that, of course, no infection. They're implanted in the fatty tissue here on the hip.
Right.
They slowly release hormones, so it's the method that most closely mimics the action of what the ovaries used to do or the testicles used to do. And women and men start feeling great. Usually in about 1 to 2 weeks, there's a noticeable difference in energy, mood, getting rid of those night sweats and hot flashes.
Do we need to make an appointment to come get the original blood test?
Yes.
You need to do that first.
Yes, so the first step is to get the appointment. We only charge $21 to get your hormones tested, and then the next step is to schedule an appointment with Nicole. She's our patient liaison, and we've trained her to know, and she'll ask, of course, if there's an issue, but she'll help that person decide, what's the next step from there. But also, if people want to learn more, I do conduct regular seminars, and we've got one coming up a week from tomorrow.
Okay, and where and what time?
So it's at our office, 850 South Pleasantburg, which is a block from Cleveland Street.
Right.
And it's just a 10-minute drive from downtown Greenville, 6 o'clock a week from tomorrow.
If you like have an appointment, you come in at 10 o'clock in the morning, can you get the results of your blood hormone results for the day's over? I mean...
No, it's going to take a few days. Yeah, we have to allow at least a couple of days.
Okay.
But yeah, some people can come in really within 2 days. They could get the report.
And know what's going on. That's great.
Absolutely.
Thank you for keeping us so informed and helping us know all these hormones and testosterone and estrogen, all this good stuff.
I got
Dr.
more
Connie.
testosterone than you got.
Well, maybe I need to go see Dr. Connie. We can even up the playing field.
Yeah.